Okay, let's look a bit at osteoarthritis, which is basically the wear and tear arthritis of joints, right? So it's where the cartilage has been thinned and worn out, and because of that, the underlying bone of the joint also has changes. Okay, so let's look at the top left image of a normal joint. So that's the hip joint. So yes, it's a ball and socket joint. It has a nice smooth hyaline cartilage, um, and it articulates with the pelvic bone, again with hyaline cartilage there. And as it wears out, the cartilage is going to thin and thin and thin, where now the bones are going to rub on each other, and it's going to lead to bony changes because of the worn out cartilage and the bone on bone rubbing. So if we look at the bottom, if we look at the top right, we can see that the hyaline cartilage is worn out, is worn away. And because there's been bone on bone movement, um, you are now left with bony spurs, which are just overgrowths of bones around the joint, and you get what's called sclerosis of the joint, meaning there's increased calcification around the joint that we can see on X-ray. So when we look at an X-ray, we can see, okay, the cartilage is worn out, the bones are almost touching each other at the joint, and the bone all around it has bony spurs and extra bone growth that we'll call sclerosis. Okay. So bottom left, look at a healthy knee joint versus a knee joint with osteoarthritis. So the cartilage is thinned, the bones have spurring, which is basically another term for, bony spurs, sorry. And the bones are undergoing changes because they're gradually being destroyed as well, since the cartilage is gone. Okay. Bottom right, we can see osteoarthritis of the hand joints. Okay. So the cartilage is completely worn out, and there's bony spurs forming at all these different joints. And that's why they look a bit craggly. It's all those extra bony spurs that are forming. Okay, so osteoarthritis is definitely the most common arthritis that you're going to see. And it's a degenerative arthritis. It's not an inflammatory arthritis like rheumatoid arthritis. Okay, and it's degenerative changes of the articular cartilage and also the underlying bone, right? So it's a gradual progression over years and years. And, typically, once we get into our 60s or 70s or 80s, we're going to have some osteoarthritic joints. Okay, so is it normal? No, it's not normal. It's just that it happens from wear and tear over many years. Okay, and as I mentioned before, it's often the weight-bearing joints that are most affected. So the hips, the knees, the ankles, but you can certainly get it in the wrist, the shoulder, the hands, all over the place. Okay, so I would really think of this one as a wear and tear. There's definitely a genetic component to it. So if your parents have severe osteoarthritis at an early age, you're more prone to developing osteoarthritis. Okay. What else makes you more prone to osteoarthritis? Well, overweight. So if your weight-bearing joints are constantly having to bear more weight, that's more force on the joints. They're going to wear out sooner. Injury. So if you had a fracture into the joint, or you had a severe ligamentous injury within the joint, or a meniscal injury within the joint, that's going to make you at higher risk for developing osteoarthritis later in life. Okay, so a pretty common condition with aging, uh, often over the age of 60, 70, or 80. Remember, it's a non-inflammatory arthritis, and you can get it certainly in your 30s or 40s if you had a significant joint injury that set you up to develop osteoarthritis. Okay? Okay, so when we think of osteoarthritis, again, the wear and tear arthritis of, um, of joints in your body, we can think of it as primary osteoarthritis, meaning we're not really sure of what caused it, but age is the highest risk factor, just the aging process and the wear and tear on the joint, right? So that would be primary osteoarthritis. There's no other disease or any other factor that's come into play that's led to the osteoarthritis except for age. And remember, osteoarthritis is not the same as osteoporosis. Okay? Osteoporosis is a demineralizing condition of bones in the body. Osteoarthritis is a joint condition, a wear and tear joint condition of wearing out of cartilage and damage to the underlying bone of the joint. Okay? So secondary arthritis is from some kind of injury that led to the osteoarthritis. So for example, trauma. So we spoke about cruciate ligament injuries, meniscal injuries. Well, they're going to set someone up for secondary osteoarthritis. Someone who has repetitive activities. What about someone who likes to jog a lot, miles and miles, 3 or 4 times a day? Well, you can imagine the mechanical stress on the joints, right? Running on pavement. There's constant pounding to the knee, ankle, and hip joints. So over time, that can lead to secondary osteoarthritis. The joint instability I mentioned in terms of, say, a cruciate ligament injury, or recurrent shoulder dislocations, that can lead to secondary osteoarthritis. Okay, so anything that's injured the joint earlier in life can lead to secondary osteoarthritis. Okay, so now what happens with osteoarthritis in terms of symptoms? So, so, so the underlying problem is the articular cartilage damage, and sometimes there is a bit of mild inflammation, but this is not an inflammatory arthritis, okay, such as rheumatoid arthritis. So typically, you have dull joint pain, often throughout the day, including the morning, but it worsens as the day goes on and you've used the joint more and more, and there's been more rubbing and movement within the joint. Okay, so osteoarthritis gets worse. The symptoms of osteoarthritis get worse throughout the day because you've used it more. You might feel crepitus or crunching within the knee, or the joint. Within the joint. Doesn't have to be the knee. I was thinking of the knee, but it could be any joint. You could have locking of the joint, where when the joint is moving, it suddenly just locks. And again, that's because of damage to the cartilage and the meniscus. Okay. So think of osteoarthritis as an arthritis that just gradually gets worse as the day goes on, and often people have to plan their day around, say, hip arthritis or knee arthritis, because they know that by 5 or 6 o'clock, their hip joint is going to be bothering them much more. Okay, so sometimes it requires a bit of planning, maybe taking some anti-inflammatories as well to settle down the joint pain. Okay, so here are the risk factors for osteoarthritis. Age, um, much more common as we age into our 70s and 80s, irrespective of injury or not, just by the very fact that it's a wear and tear arthritis. Females are more prone. That's not to say that males don't get osteoarthritis. For sure, females and males do, but females get osteoarthritis a bit more commonly. Genetics plays a history. I mentioned if you have a parent with early onset osteoarthritis, you're more prone to developing osteoarthritis. Obesity, because of the constant micro trauma to the weight-bearing joints, such as the hips and knees. A history of joint injuries at an early age or a fracture into a joint sets someone up for osteoarthritis. And finally, repetitive manual work or activities will lead to osteoarthritis because really it's just a joint, and if a joint is used repetitively, whether it's for leisure or for work, it will lead to wearing out of the joint. Okay, so let's just talk briefly about the pathophysiology of osteoarthritis. So there's chondrocytes, which are the cells that have produced the cartilage, and they begin to produce proteases that start to destroy the joint tissue. And we start to see cracks in the cartilage that travel right through to the bony part of the joint, okay? And that's going to cause bone, deformed bone developing. And we get osteophytes. So osteophytes are now outgrowths of bone around an arthritic joint, okay? And as well, we get bone cysts forming. So underneath the damaged, worn out cartilage from the proteases that have been just gradually destroying the cartilage, we have bone disease. So the osteophytes I mentioned, which are outgrowths of bone, and we have bone cysts forming, which are basically just empty sacs within the bone themselves, and they're classic for osteoarthritis. And we can see these changes on X-ray, right? So we'll see a very thin synovial cartilage. We'll see, the hyaline cartilage. We'll see osteophytes forming, those little craggly, bony outcroppings, and we'll see bone cysts forming, okay, of the affected joint. So it's not only just erosion of the cartilage, it's also erosion and damage to the underlying bone of the joint. Now, because osteoarthritis it's not a systemic disease, it's a local joint disease. I mean, you can have many joints involved, but it's not causing systemic symptoms such as fevers and inflammatory symptoms, okay? So it's really localized to the joints that are involved. And as I mentioned, where are the most common joints for osteoarthritis? Well, for sure, the weight-bearing joints, such as the hips and knees, the vertebral column, very common to get osteoarthritis. The hands, a very common place, and that makes sense because we use our hands a lot, and you get this wear and tear type of arthritis. And finally, as well, joints within the feet are a common place. But that's not to say that you can't have osteoarthritis of any joint in the body, okay? And it's an asymmetrical joint involvement. So just because your left wrist is involved, it doesn't mean that your right wrist is involved. Or if you have left knee osteoarthritis, it doesn't mean the right knee is osteoarthritic, okay? So because it's a localized problem to the joint, it's not a systemic problem, such as rheumatoid arthritis, where you typically have symmetrical joint involvement on both sides of the body. So how do we usually treat osteoarthritis? Well, it depends on the level of the joint destruction, right? And by the way, an X-ray can show severe osteoarthritis, but the patient may be complaining of minimal symptoms. So X-ray findings don't correlate with the symptoms the patient is experiencing. And the other way around is someone can have a lot of symptoms from osteoarthritis, but when we X-ray it, it shows minimal damage. Okay, so they don't always correlate. So what do we treat osteoarthritis with? Well, if it's relatively minor to moderate discomfort, acetaminophen and non-steroidal anti-inflammatory drugs can be used. Sometimes, if it's the knee joint or a very accessible joint, we'll inject a corticosteroid to reduce the inflammation that can sometimes occur within the joint of osteoarthritis. And that makes sense because bone is rubbing on bone. There's going to be a bit of inflammation within the joint. Okay? We try not to inject them too frequently because it leads to joint breakdown if we're injecting corticosteroids frequently into a joint. There's different products out there that are basically like oil for a joint. So we can inject certain products that add lubrication to an osteoarthritic joint, and it might buy someone 3 to 6 months of reduced symptoms. Okay, it's not a permanent fix. There's non-steroidal anti-inflammatory creams like Voltaren gel, which is diclofenac. That can be used for osteoarthritis. Weight loss, well, that's going to allow that joint to last longer. And finally, joint replacements, right? So hip and knee replacements are extremely common and very effective. So those two particular joints, because they're so commonly replaced, the procedure has been really fine-tuned, and patients end up with really fantastic outcomes with hip and knee replacements.